Something big is happening in India's healthcare world. If you run a clinic, you're probably feeling it from two sides, right? On one hand, you've got to be more efficient than ever. But on the other, a whole new set of data security laws just dropped. And let me tell you, they have some serious teeth. So let's just cut to the chase. Here's the question you absolutely need to ask yourself. Is your clinic ready for these new data laws? Seriously, are you ready for what's about to happen? Because, sticking with the old ways of handling patient info, well, it's not just clunky anymore. Frankly, it's a huge financial risk. Okay, look at this number. Just let it sink in for a second. 250 crores. Now, this isn't some made-up number to scare you. No way. This is the potential penalty for just a single data breach under India's new law, the Digital Personal Data Protection Act of 2023, or DPPA for short. This is an absolute game changer. Right, so we're talking about the new reality, the high cost of non-compliance. And look, this new world we're in, it's about so much more than just that one huge fine. That number, it's a signal flare. It's telling us that data protection isn't some side job for the IT guy anymore. Nope. It's now a core part of your business, and handling it wrong, well, it could literally decide if your clinic keeps its doors open. And listen, with this new law comes a new title for you, and you've got to know it. It's data fiduciary. Sounds formal, right? But what it means is simple. If your clinic collects any patient data, and I mean anything from a name and number to their full medical history, the law says you are now a fiduciary. And what that means is you have a legal, mandatory, completely non-negotiable duty to protect that information. And don't think for a second the government is just going to throw a fine at you and call it a day. Oh no, their strategy has layers. First, yeah, you've got those huge financial penalties. But then they can hit you with mandatory audits. They can literally come in and pick apart your systems. On top of that, patients can sue you for compensation. And maybe worst of all, public reputational sanctions that can just destroy the trust you've built with your community. Okay, so let's talk solutions, because this is a system built for today's challenges. And yeah, the problem is big, it's serious, but the good news? There's actually a solution out there that's been specifically built to tackle both of these things at once, making your clinic run smoothly and keeping it totally compliant. So where does this solution come from? A company called VoiceGate. And these guys aren't new to the game. They've been a trusted tech partner here in India since, get this, 1998. We're talking decades of experience building really solid, reliable systems for industries where you can't afford mistakes, especially healthcare. And their platform, the one built exactly for this moment, is called VCLICS. Its whole mission is right there in the tagline: efficient clinics, connected care, better outcomes. I mean, just listen to that. It's so simple and powerful. This isn't just about loading up some new software. It's about completely changing the game for how your clinic works and how you care for your patients. All right, so let's get into the nitty-gritty. How VCLIS transforms operations. How does it actually do what it says it's going to do? How does it take a clinic from that chaos of paperwork and disconnected systems to something that's smooth, efficient, and totally compliant? Well, the secret sauce is really in its modules. It covers everything, the whole shebang. We're talking patient registration and EMR, appointments, clinical workflow, billing, pharmacy, diagnostics, even reports and analytics. The key thing here is that it's all one system. It's not a bunch of different programs cobbled together. It's one unified platform that handles the entire patient journey, from start to finish. So let's follow the data, shall we? It all begins with this seamless flow. Think about it. A patient walks in and registers. Their info gets put into the system just one time, and it's done right. That's it. You've just created a single source of truth, killing potential errors before they even have a chance to start. And then, boom, that exact same data flows instantly into their electronic medical record, right into the clinical workflow. Nobody is retyping anything. There are no lost paper files. Your doctors and nurses get the right patient history right away. And you know what that means? Faster, safer, and just plain smarter decisions for patient care. And then it all comes full circle with the integrated pharmacy and billing. Prescriptions pop up directly from the EMR, which slashes the risk of errors. And the billing? It's all automated based on what was actually done. This creates a process that's just so clean, so transparent, and honestly, way less of a headache for your staff and your patients. So what's the bottom line here? What does all this efficiency actually get you? Well, the results are real, and you'll see them fast. Patient wait times, they go way down. Your revenue efficiency, it goes way up because you're catching all those little billing mistakes. And the big one, your patients just have a much, much better experience.
But hold on, it's not just about making the day-to-day run smoother. Let's zoom out and talk about the strategic business advantage. Because for anyone running a clinic, a system like VCLICS is more than just a tool. It's a massive strategic asset, especially now with these new laws. This is where you see how being compliant actually helps you grow. Think about it. When your patients know their data is safe, they trust you more. They're more willing to share information, which means you can give them better care. You're also dodging those monster fines we just talked about. And hey, in today's market, being able to say you're DPDPA compliant, that's not just a legal requirement, that's a huge marketing win that builds your brand. I mean, just look at the difference. The before picture is probably familiar. Data all over the place, high risk of a breach, long waits, and tons of manual reporting. But the after with VCLICS, it's a completely different world. You've got connected care, you're DPPA compliant, patient flow is smooth, and you've got real-time data dashboards to guide your decisions. It's a total transformation. So, this really is about future-proofing your practice. At the end of the day, bringing in VCLICS isn't just about a software upgrade. It's a real investment in the future of your clinic. It's about building a practice that's tough, that's secure, and that's ready to handle whatever the future of healthcare throws at it. Which really just leaves us with one final crucial question. In this new world of digital health and super strict data laws, take a hard look at your practice. Is it just trying to survive day to day, or is it actually built to thrive? Because that's the difference a system like VCLICS can make.